Unit 5, Human Development, Young Adult through Older Adult. Adulthood is divided into 3 stages of age groups: young adult, middle adulthood, and older adulthood. Young adulthood spans from ages 18 to 34 years old. Middle adulthood includes people from 35 to 65 years of age, and older adulthood includes those 66 years old and beyond. At each stage, the person is tasked to achieve specific developmental milestones. Various researchers have developed theories and specific tasks that can be identified as evidence through transition of these life stages. Theories on aging and adult development. Biologic aging, or sensience, is defined as a normal physiologic process that occurs at the cellular and molecular levels and is universal and irreversible. Life expectancy is the average number of years of life remaining at a given age. The wear and tear theory of aging proposed that the body wears out from hard use. Wear and tear is not confined to the organs, it also takes place on a cellular level. Aging at the level of DNA and body cells, cells can vary in shape, size, function, however they endure the aging process. Theories that emphasize the cumulative effect of random events suggest that DNA is gradually damaged owing to the changes in DNA caused by the internal and external forces. This leads to mutations that accumulate, and thus cell repair becomes less efficient, or cancerous cells can develop. Free radicals are another cause of cellular abnormalities. They are naturally occurring, highly reactive chemicals that form in the presence of oxygen. Free radicals are related to many disorders of aging, including cancer, cataracts, heart disease, and arthritis. Antioxidants, vitamin C and E, and beta-carotene can limit this damage. Young adulthood. Physical changes due to aging. As aging occurs, the body goes through physical changes that are universal and irreversible. Diseases and illnesses appear to be the primary causes of the functional losses during old age. Review the table in your book that reviews physical changes associated with normal aging in the textbook. Young adulthood. The transition phase from adolescence to young adulthood for people aged 18 to 34 is marked by many changes physically, psychologically, and socially. A career, marriage, and economic independence are signals that many have reached adulthood. There have been many social, cultural, economic, and demographic changes in the last few generations, and these changes are challenging young adults' psychological and social development. Some adapt well and make good decisions about their education and vocational paths and their relationships with their peers, while others struggle with this transition period in which definitive decisions about their work, school, and life may be constrained by lack of resources or education, by early parenthood, or low-paying jobs or unemployment. This transition phase may be marked by periods of experimentation with drugs, multiple casual or intimate relationships, and reckless behaviors that may have untoward consequences. Young adults may find themselves needing assistance from family, friends, and their community, and a society to successfully complete this phase of life. Please review the box in your book that reviews diversity considerations in your textbook. Today, there is much slower transition to adulthood marked by indecision and lack of commitment to one fixed goal in life. This prolonged transition phase is now being called emerging adulthood. According to Arnett in 2006, the explorations of emerging adults and their shifting choices in love and work make emerging adulthood an exceptionally full and intense period of life, but also an unstable one. From the late teens to the late 20s, a prolonged exploration of these possibilities available in love and work precedes commitment to enduring choices. During the young adult phase of life, individuals reach their peak growth physically. Young adults are at top physical condition between their late teens and early 30s, after which they may start to slow down physically and mentally. This is an opportune time to do a complete assessment of the individual's lifestyle, emphasizing wellness and health promotion activities and disease prevention for those individuals who see a healthcare provider on a regular basis. Cognitive abilities are strong during the young adulthood. In addition, typical is an increase in rational thinking, motor, conceptual, and problem-solving skills as a result of formal education, occupational training, and overall life experiences. Many theories offer help in understanding human development and tasks associated with stages of development. According to the lifespan perspective, no age period is superior to another in terms of impact on the life course. The psychoanalytical perspective hypothesizes that individuals progress through a series of stages in which they confront conflicts between biological and social expectations. The resolution of these conflicts determines the individual's ability to thrive. According to Erickson, the initial stage of being an adult is intimacy versus isolation. Young adults try to find satisfying relationships primarily through marriage and friends, and many start a family. In today's society, family life may begin much later, with individuals not having children until their late 30s. If people are able to negotiate this stage successfully, intimacy is experienced on a deeper level. Young adulthood is a time of dramatic change in personal relationships. Young adults seek emotional and physical intimacy in relationships with peers and romantic partners. Self-disclosure and a sense of belonging are important aspects of intimacy. Intimate relationships are associated with physical and mental health. Most young adults have friends but have increasing limited time to spend with them. Many non-traditional family options are seen in the U.S. as people postpone marriage or choose to cohabitate. Reasons for evolution of non-traditional lifestyles vary in accordance with environment, life situation, socio-economic level, and relevant legislation. Attention is focused on the attainment of higher education and jobs that pay well in an attempt to improve lifestyle. With economic downtrends, many college graduates are forced to accept employment in positions that are less fulfilling, and pay for that will meet only basic needs. These factors and others require that family and friends provide financial and social support to sustain young adults. Health risks and concerns during young adulthood. The focus of nurses providing care for young adults should be on identifying factors that lead to unhealthy lifestyles and increased risks of illness and injury. Among young adults aged 24, approximately 13% are cigarette smokers. The percentage rises to nearly 18% for young adults 25 and up. E-cigarettes are growing in popularity and the health effects are not yet known. Alcohol use contributes to increased mortality from unintentional injuries, including motor vehicle accidents while people are driving under the influence. Drinking in excess and binge drinking can cause immediate danger and long-term effects. The use of illicit drugs such as marijuana, heroin, cocaine, including crack cocaine, methamphetamines, hallucinogens, and other illegal drugs used recreationally, and non-medical use of prescription drugs such as pain relievers, stimulants, and depressants, is associated with serious health and social consequences. These include injury, illness, disability, death, as well as crime, domestic violence, and loss of school and workplace productivity. Please review the table in your book on commonly abused drugs. Intimate partner and domestic violence, dating violence, and sexual violence are pervasive problems in the U.S. and other countries. Abuse can result in death and injuries, and mistrust or shattered sense of well-being that is a barrier to moving forward in life for some victims. Sexual violence may result in unwanted pregnancy. Healthcare providers need training to assess patients for signs of abuse. Approximately 3 in 10 women and 1 in 10 men in the U.S. report experiencing violence by a current or former spouse or intimate partner at some point in their lives. Both physical health and mental health are affected by intimate partner violence that results in injury, disability, flashbacks, panic attacks, and low self-esteem. The stress can lead to depression and harmful health behaviors such as smoking, drinking, using drugs, and having risky sex in a way to cope with the trauma. Nurses have a responsibility to ask patients whether they are being abused. Phrasing the question correctly during the patient encounter can mean the difference between life and death. Please review the box in your book on health assessment questions. Most healthcare organizations have counselors and nurses trained in handling abuse, so novice nurses should seek help when needed. Review the box in your book on interprofessional collaboration and delegation for domestic violence. According to the National Adolescent Health Information Center, motor vehicle accidents accounted for 31% of deaths among adolescents and young adults in 2003, followed by homicides at 14.8% and suicides at 11.2%, and unintentional entries at 13.7%. Please review the box in your book on diversity considerations, lifespan, and gender in the textbook. Early detection of illness and disease can be accomplished when young adults participate in periodic health screenings. For young women, these screenings include annual pap smears for those that are sexually active. Immunizations include HPV are recommended for this age group. A complete schedule of immunizations for adults is available on the CDC website. Screenings for changes in skin are also advised, as many young adults spend time exposed to ultraviolet rays, whether at work or at play. Nurses can serve as a catalyst to move young adults to action when it comes to health promotion activities. Young adults are often fixated on their bodies and the idea of being appealing to the opposite sex. Nurses should emphasize proper nutrition and exercise to promote good health among young adults. Exercise helps decrease risks of heart disease, obesity, diabetes, and cancer. It strengthens the heart and reduces anxiety, improves mood, and enhances the overall subjective sense of well-being. Please review the box in your book on patient education, health literacy, exercise in your textbook. Mental, emotional, and behavioral (MEB) disorders, which include depression, conduct disorders, bipolar disorder, schizophrenia, and substance abuse, are seen in large numbers in young adults. Almost 1 in 5 young people will have one or more MEB disorders at any given time. Many disorders have lifelong effects, including high psychosocial and economic costs. Screening should be part of a nurse's assessment for young adults, with referral to mental health services when indicated. Please review the box in your book on health assessment questions, mental health conditions. Some young adults engage in risky sexual behaviors which can result in negative health outcomes. These behaviors, while signaling a most certain freedom from commitment, can increase the risk of sexually transmitted diseases, both in males and females. The most commonly sexually transmitted diseases include gonorrhea, chlamydia infection, herpes simplex, and HIV, syphilis, and HPV, human papillomavirus. Please review the box in your book on evidence-based practice and informatics, HPV, genital warts, oral cancer in your textbook. Because of the temporary nature of many relationships in young adults, nurses should encourage that all sexually active adults get screened for STIs. Nurses have the knowledge and skills necessary to teach patients about safe sex practices and the signs and symptoms that need to be reported and investigated. Please review the box in your book on patient education, health literacy, sexually transmitted diseases. Middle adulthood. Middle adulthood age 35 to 65, is a time of adjustment for many adults. This transitional stage of life is marked by physical changes and adaptations to challenges such as making career changes, children leaving home for college or returning home from college, or caring for aging parents. Please review the box in your book on diversity considerations, lifespan, and gender. Middle adulthood is often difficult to define because people in this stage of life exhibit a wide variation in attitudes and behaviors. For some, certain personal choices have led to a very fulfilling life, whereas for others, such choices have led to significant changes and stresses in their lives. Children may leave home during this time, and retirement often looms. Recent advances in medicine and technology offer the opportunity to live a better quality of life with a slower transition to old age. Physical changes are evident in middle age as it progresses. Wrinkles become evident on the face, hair thins, the waist thickens in most middle-aged adults. Muscle tissue or muscle mass and muscle strength tend to decrease beginning in the 30s. This process is called sarcopenia, which means loss of flesh. Crystallized intelligence refers to the skills that depend on accumulated knowledge and experience, good judgment, and mastery of social conventions. This type of intelligence increases through middle adulthood, and adults add to this knowledge with their skills and leisure activities that are practiced on a daily basis. Fluid intelligence represents basic information processing skills, that is, the ability to detect relationships among stimuli, and the speed with which information is analyzed, and the capacity of working memory. Changes in mental ability seem to be related to the generalized slowing of the central nervous system. The neural processing speed decreases. Well-practiced skills aren't noticeably affected, and adults find ways to compensate. Some people lose cognitive function as a consequence of illness or adverse environments. Others remain creatively intellectual well into very old age. Those who keep their intellect active usually are busy using their skills in work, leisure pursuits, travel, reading, cultural and arts endeavors, and civic commitments. Please review the box in your book on diversity considerations lifespan in your textbook. Primary developmental tasks. Middle adulthood is a time when many people reevaluate their lives, looking for meaning of their existence, refine and strengthen their identities, and reach out to younger generations. Erickson's theory, generativity, means reaching out to others in ways that guide and give to the next generation. In midlife, this activity extends beyond the nuclear family to social groups and communities. The alternative to generativity is stagnation, becoming self-centered and narcissistic. In stagnation, people place their own comfort and security above challenges that include other people. Middle adulthood, health risks and concerns during middle adulthood. Please review the box in your book on patient education and health literacy, factors that promote well-being in midlife in the textbook. Cancer is the second leading cause of death in the U.S. The death rates for all cancers have been declining over the past 15 years because of either early detection or advanced treatment. Please review the box in your book on patient education, health literacy, reducing cancer risk. Cardiovascular disease affects about 1/4 of middle-aged Americans. These diseases include high blood pressure, high blood cholesterol, and atherosclerosis, or a buildup of plaque in the coronary arteries around the heart. Myocardial infarction, MI, is a blockage of blood flow to the heart, is the most extreme symptom and largely due to a blood clot in the coronary artery. Please review the box in your book on patient education and health literacy, reducing the risk of cardiovascular disease. Health assessments conducted in people in middle-aged adults should address physiological and psychological problems that can be experienced during this period of life, such as heart disease, diabetes, obesity, hypertension, arthritis, chronic obstructive pulmonary disease or COPD, migraines, anxiety, and depression. Please review the box in your book on health assessment questions, middle adulthood. Health promotion activities for middle adult should address adequate rest, leisure activities, regular exercise, good nutrition, satisfactory sexual function, and reduction of cessation of tobacco products and alcohol use. Adults should be encouraged to have regular health screenings, such as blood pressure screenings, colonoscopies, prostate exams for men, and mammograms and pap smears for women. Domestic violence should be assessed in both men and women. 9 of 10 middle-aged adults live in families, most of them with a spouse. This period of the life cycle is known as the launching children and moving on stage. In the past, it was known as the empty nest period, but it is no longer seen in such a negative light. Households at the middle stage tend to be better positioned economically and financially than they were previously. However, recently, many middle-aged adults have found that more savings are needed for retirement than was known in the past. In addition, this period often is when marriages have experienced some turmoil and will end, and former partners venture out to start new. Most divorces occur within the first 5 to 10 years of marriage, but 10% occur after 20 years or more. At midlife, divorce seems to be more manageable emotionally. People who are better educated and employed are more likely to be divorced because they can better support themselves. In the U.S., approximately 4 to 5% of child population live with grandparents and apart from parents, who are called the skipped generation. This arrangement may occur as of consequences of parental substance abuse, emotional illness, or physical illness. Custodial grandparents often face high levels of stress and frustration and a decline in health as they attempt to provide stability for their grandchildren. According to a University of Michigan study in 2011 on health and retirement, almost 10 million adults over the age of 50 care for their aging parents. Adults age 50 and older who work and provide care for parents are more likely to have fair or poor health than those who do not provide such care. In terms, sandwich generation refers to middle-aged adults who are the caretakers of multiple generations of their families. More middle-aged adults are now caring for their children or grandchildren and for their aging parents who may no longer be able to care for themselves. Many baby boomers provide financial support to adult children and financial assistance to a parent. This multiple generation caretaker role generates many stressors that can lead to a breakdown in the caretaker's health and functioning. Please review the box on evidence-based practice and informatics on chronic stress affects people in different ways. Please review the box on patient education and health literacy on tips and dealing with caregiver stress. Older adulthood. Society has defined the older adult as anyone older than 65 years of age. There are 47.8 million older Americans, with the number estimated to more than double to approximately 98 million by the year 2060. The older population of the U.S. is becoming increasingly more radically and ethnically diverse as the overall minority population grows and experiences increased longevity. As a result, it is critical that nurses understand that each person is unique, whether along the dimensions of race, ethnicity, gender, sexual orientation, socioeconomic status, age, physical abilities, religious beliefs, political beliefs, and other ideologies. Ageism is an outcome of urbanization and industrialization resulting from the emphasis on the negative and debilitating aspects of old age and is a form of perceptions that older people are unproductive. Age-specific differences in physical appearance and mobility involve the changes of skin, hair, facial structure, and body build. The physical capabilities of older adults are not the same as they were in earlier stages of life, although many older adults remain agile and physically fit later in life. There are obvious signs of aging. The hair becomes gray, The facial skin and other parts of the body become wrinkled because of loss of skin elasticity and collagen content. Height declines as the spine collapses and there is bone loss and decreased muscle tone. Reactions slow and the senses of this become less acute. Cataracts and glaucoma may affect the eyes, and hearing loss is common. Mobility declines as muscle strength declines by 30 to 50% after age 70. The changes of aging affect the internal functioning of the organ systems are occurring simultaneously with the alterations that can be seen. The brain decreases in size but retains its structure and function in the absence of disease. The heart pumps less blood through the body. The respiratory system is less efficient. The digestive system produces smaller amounts of digestive juices, which affects the movement of food through the intestines and therefore increases the likelihood of constipation. Taste and smell decreases in acuity over time, causing food to be less appetizing. This has been an unfortunate side effect for older adults who tend to eat less because it tends to lead to undernutrition. During the normal aging process, the mental health and cognition remain relatively stable. Severe changes in behavior and loss of cognitive function are usually symptoms of physical or mental illness such as Alzheimer's disease, acute delirium, or severe depression. Nursing interventions are according to history, what previously has been effective in patients with cognitive changes. Because polypharmacy is a primary cause for delirium, it is important for the nurse to thoroughly assess the patient's medication list. Drug therapies have been effective at slowing Alzheimer's disease and managing serious depression. Important strategies for nurses caring for patients in this age group are to maximize safety by modifying the environment to compensate for cognitive losses, to plan and maintain a consistent routine, and to teach caregivers how to identify burnout from daily care of older adults with cognitive changes. According to Erickson, 1963, the developmental task of older adults is ego integrity versus despair. Older adults who attain ego integrity view life as wholeness, receiving satisfaction from past accomplishments, accepting death as the completion of life. By contrast, older adults with despair often believe that they made poor choices during life's journey and wish they could live their life over again. The majority of income for people in the U.S. older than 65 is from retirement benefits. Those who are still able to work have a better income and sense of worth and are able to continue lifelong established routines. Living arrangements are influenced by a variety of factors, including marital status, financial well-being, the value placed on living independently or with family members, the availability of social services and support, health status, family size and structure, and cultural traditions. With increasing age, living arrangements may need to change and adapt to the changing life circumstances. Please review the box in your book on diversity considerations lifespan. Older adults, whether healthy or frail, need to express sexual feelings, which include passion, affection, and admiration. Sexuality is a basic human need that has a psychological, social, moral, biologic component. Sexuality in the older adult shifts from procreation to companionship, intimate communication, and pleasure-seeking physical relationships. Older adults fare best when they retain social status and opportunities for community participation. When older adults are excluded from social roles, their sense of well-being is reduced. Emerging issues in healthcare in older adults include the following: coordinating care, helping older adults manage their own care, establishing quality measures, identifying minimum levels of training for people who care for older adults, and also researching and analyzing appropriate training to equip providers with the tools they need to meet the needs of older adults. Common causes of death in the older adult are heart disease, cancer, cerebral vascular accidents or strokes, lower respiratory disease, pneumonia, influenza, and complications from diabetes and Alzheimer's disease. Because aging is associated with a weakened body's immune system, older adults are more susceptible to infectious diseases. Common chronic illnesses associated with a significant impairment of function in the older adult are osteoporosis, osteoarthritis, rheumatoid arthritis, chronic obstructive pulmonary disease, hearing and visual alterations, and cognitive dysfunctions such as dementia. In addition, acute illnesses such as pneumonia, fractures, trauma from falls and motor vehicle accidents may create chronic health problems. Stroke is the leading cause of long-term disability among adults in the U.S. Strokes are cerebrovascular accidents that affect the cerebral circulation through blockage with occlusive thrombi and emboli in the subarachnoid and intracerebral spaces. Hypertension is a major risk factor for experiencing other cardiac-related illnesses. Hypertension refers to the elevated blood pressure readings, either diastolic or systolic or both, over a period of time. Systolic hypertension is common in older adults. Regular eye exams are encouraged in hypertensive patients. Older adults are less likely than young adults to be screened for cancer, so cancer in older adults often goes undiagnosed or are discovered in later stages of the disease. Common cancer in older adults include lung, skin, breast, colon, ovarian, and brain cancers. In some older adults, the disease may lead to cognitive compromise. Age-related changes or senescence occurs over time that can affect the maximal inspiratory and expiratory force. Examples of senescence include kyphosis, or increased curvature of the spine, poor posture, a shortened thorax, chest wall stiffness, and increase in anterior-posterior diameter of the chest wall that result in diminished respiratory efficiency. Tobacco use or smoking is a major factor in the development of lung disease and impaired respiratory function. COPD is a prevalent respiratory condition that may necessitate hospitalization of the older adult. Age and smoking are two of the major risk factors for COPD, which is a group of diseases including emphysema, chronic bronchitis, and a subset of asthma characterized by chronic airflow obstruction. Please review the box in your book on Health Assessment Questions COPD. Normal changes of aging often bring about complaints of the musculoskeletal pain and various joint limitations. These chronic conditions can limit mobility and impair the ability to perform self-care activities such as bathing, dressing, cooking, and these changes may result in a loss of independence. Osteoporosis and osteomalacia are metabolic bone diseases. Osteoarthritis, rheumatoid arthritis, and gout are joint diseases. The nurse should assess the patient's ability to prepare a meal and safely use medications, monitor the patient's pain level, and check for risk factors that may impair musculoskeletal function. Diabetes mellitus is a highly prevalent disease that increases in incidence among people older than 65 years of age, particularly in racial and ethnic minorities. Insulin is needed to transport glucose into the cells for cellular metabolism. In diabetes mellitus, there is a problem with the insulin production or use. Two major types of diabetes affect the older adult: type 1 and type 2. Type 1, formerly called juvenile onset or insulin-dependent diabetes, is the result of pancreatic islet cell destruction and the total deficit of circulating insulin. Type 2 diabetes, formerly called non-insulin dependent or adult onset diabetes, results from insulin resistance with a defect in compensatory insulin secretion. The clinical signs and symptoms of diabetes in the older adult include dehydration, confusion, delirium, decreased visual acuity, fatigue, nausea, recurrent infections, delayed wound healing, and paresthesia. Complications can develop because of poor glycemic control. Many older adults live active and healthy lives, but aging occurs and bodies and minds change. Eating a healthy diet, exercising regularly, refraining from risky behaviors such as smoking and drinking excessively can help maintain the patient's health. Regular medical checkups and immunizations are also beneficial. Screening tests needed depend on the patient's age, gender, family history, and risk factors for certain diseases. Screening should be a primary focus of health promotion because of the potential for early detection of cancers such as breast and colon cancer. Nurses should focus the patient education on cancer prevention, vaccinations that protect against influenza and pneumococcal disease, screening for early detection of diabetes, lipid disorders, osteoporosis, hypertension, fall risk assessment, elder abuse, and smoking cessation counseling. In 2015, a small number, or 1.5 million of the population, or 3.1% of the population of adults, lived in institutionalized settings such as nursing homes. This older population will continue to grow significantly. Please review the box in your book on ethical, legal, and professional practice, ethical legal issues in nursing homes. The median home income of older adults in 2015 was $31,372 for males and $18,250 for females. Almost all non-institutionalized older adults were covered by Medicare in 2015. Some had private insurance, some had military-based insurance or Medicaid. Limitations in activities because of chronic conditions will continue to increase with age. Many community residents, older adults with chronic disabilities, receive either informal care from family or friends or formal care from services. Please review the box in your book on interprofessional collaboration and delegation, home care of older adults. Technology in the world will continue to advance, and many more devices are being developed that permit people with disabilities to improve their function. Such devices include computers and phones that can be dialed with voice command and can print out spoken words of the caller, allowing blind and deaf people to remain independent. A computer chip can be placed in a medicine bottle to remind the older adult to take these medications on schedule. And architects are building smart homes with features that promise and promote safety and mobility.